Okay, hi, my name is Jania Garcia, and for this video I'm going to show you how to do an injection, an intramuscular injection, in a few steps. The first one and the most important is to verify the medication order. It's really important to make sure that we have the right patient, the right drug, the right dose, the right road, and the right time. And it's also important to ask the patient about the allergies. Okay, now for the step 2, I know it's really basic, but it's really crucial to do it, and is to wash hands and to don gloves. Now for the step 3, we're going to prepare the injection. For this step, we're going to take the syringe and draw some air. Now we're going to take the needle and put in the vial. Okay, we're going to draw some air, inject the needle, we're going to inject the air and withdraw with the correct dose. Okay, now we want to make sure that there's no bubble by tapping the syringe. Okay, now for the step 4, we're going to prepare the zone for the injection, and for this step it's really important to know that in the glutes, for the glutes injection, we have 4 quadrants: the upper left, the lower left, the upper right, and the lower right. So we're going to make an imaginary lines, and we want to make sure that we are on the upper right, because this keeps us away from the large vessels and the sciatic nerve. And we also have to tell the patient that this is going to hurt, but just a little bit, just a few seconds. So for this reason, the patient needs to be relaxed, their muscles needs to be relaxed. And we're going to clean the skin with alcohol. Okay, now for the step 5, we just have to make an imaginary lines, and we're going to clean the skin with alcohol. And now we're going to take the syringe, and there's no bubbles, and we're going to stretch the skin out, and we're going to inject in a 90 degrees angle in just one smooth motion. Now we want to aspirate just a little bit, just to make sure that we are not in a blood vessel. So now that we can see that there's no blood, we can inject the medication slowly with the syringe stabilized, and make it in a few seconds, not too fast but also not too slowly. Now we're going to take the syringe in the same angle, just in one movement, and we're going to discard the syringe in the sharp container. Now the last step is just to put some pressure into the skin and put a bandage. And this is everything, just to do an injection. And also it's really important to remember that we have to verify the right order for the medication, and to ask about allergies, and just to make the injection in one movement. So with this movement, we want to make sure that there's no more pain on the patient. So thank you.
Hello, my name is Denise. In this video, I will explain what bandaging is. I will also show some bandaging techniques, when they are used, and which part of the body they are used on. Bandaging is a technique used to protect, support, or keep a part of the body from moving. It is important because they help prevent infection, reduce swelling, lessen pain, and helps a patient recover. Now, I am going to explain the figure 8 bandage for the ankle. This type of bandage used for sprains twice or provide joint support. First, we place the foot at 90-degree angle. We start the circular wrap around the angle to secure the bandage. After that, we bring the bandage down toward the top of the foot. We pass the bandage under the foot and bring it back up to the angle, forming a figure 8. We repeat the figure 8 pattern several times, recurring necessary area. To finish, we make a circular wrap around the angle to secure the bandage. And finally, it's very important to check the circulation of the foot to make sure the bandage is not too tight. Now I will explain the figure 8 wrist bandage. This bandage is used for pain, nerve sprains, and tendinitis. First, place the hand with the wrist straight. Start with 2 wraps around the wrist, hold the bandage. Bring the bandage to the palm of the hand. Pass the bandage over the back of the hand and go back to the wrist, making a figure 8. Repeat this a few times and finish with a wrap around the wrist. Secure the bandage and check movement and circulation. In conclusion, proper bandaging is an essential skin and medical care. Applying the correct technique helps stabilize the joint, reduce pain and swelling, and prevent further injury. Thank you for watching.